The discovery that 5 nurses from the same hospital floor in Massachusetts have developed brain tumors is deeply unsettling, despite the hospital's reassurances that there is no identifiable environmental risk. Newton-Wellesley Hospital, part of the Mass General Brigham network, has emphasized that the tumors are benign and of 3 different types. However, the mere fact that this cluster occurred among a small, closely connected group of healthcare workers in the same location raises serious questions that can't be easily dismissed by inconclusive investigations or public statements of confidence. The hospital's internal review, which concluded that there are no environmental dangers present, included an examination of potential sources such as disposable masks, the water supply, radiation from nearby X-ray equipment, and the chemotherapy department located on the floor below. While these elements were reportedly ruled out, the scope and depth of the investigation remain unclear, particularly as it did not appear to involve a broad survey of affected staff or prolonged environmental monitoring. The claim that the issue has been thoroughly addressed feels premature, especially considering the complexity of determining environmental links to brain tumors, which can take years to manifest and require long-term data analysis. Moreover, the Massachusetts Nurses Association has raised valid concerns about the limited nature of the hospital's investigation. The union suggests that the inquiry focused on a small number of individuals and did not comprehensively assess the working environment, hinting that the conclusions were possibly shaped to reassure rather than to uncover deeper truths. An independent scientific investigation is now underway, but it is still in early stages and could take weeks or longer to produce any meaningful findings. Until then, nurses, staff, and patients are left in a fog of uncertainty. Even if all 5 tumors are benign, the psychological and emotional toll on those affected and their colleagues should not be underestimated. The fear that something in the workplace might be harming staff, especially in a setting dedicated to healing and care, can quickly erode trust in management and safety protocols. Furthermore, the term benign does not negate the seriousness of a brain tumor, which can still require surgery, long recovery periods, and can lead to lasting complications or disruptions to quality of life. The fact that 11 staff members came forward with health concerns and 5 were diagnosed with brain tumors is not something that should be easily waved away. While statistically rare, this kind of pattern warrants ongoing attention, especially in light of public health guidelines for identifying cancer clusters. The American Cancer Society notes that 4 in 10 Americans will develop cancer at some point in their lives. But the question here isn't just one of probability. It's about pattern, proximity, and possible shared exposures in a highly specific context. Without transparency, extended research, and a willingness to accept inconvenient possibilities, institutions risk not only missing critical insights, but also undermining the confidence of their employees and the public. The hospital may have followed protocol, but protocols sometimes fall short. In this case, the appearance of closure may be far more dangerous than the uncertainty itself. For those still working on that 5th floor, the fear that something unseen might be affecting their health has not been put to rest. Until the independent investigation concludes and wider assessments are made, it's hard to accept that all is truly well, especially when human lives are involved.